Okay, so today we're going to do a deep dive into AI and radiology.
Sounds good.
Specifically, this research paper about AI and chest x-rays and how it can help doctors make better decisions.
Yeah, this is a really interesting study because it actually goes beyond just
Okay.
looking at if the AI gets the diagnosis right or wrong. It looks at how different ways of showing those results can actually impact the doctor's confidence, which is really important, obviously.
Yeah, I mean, confidence is key in any field, but especially in medicine, right?
Exactly.
So how did they even study that? Like, how did they approach that confidence element? I know there was this term two-factor retrieval.
Yes.
What is that all about?
So two-factor retrieval, or 2FR as they call it, is this really cool new method where basically the AI gives its diagnosis and then pulls up a bunch of examples of similar x-rays that have already been confirmed by other doctors.
So it's kind of like giving the doctor like a reference guide almost.
Exactly.
Yeah, to be like, okay, yeah, I've seen this before.
Yep. And it really lets them compare and contrast, which is how doctors are trained to think anyway.
Oh, interesting.
And the other cool thing about this study is they didn't just do this with radiologists, who are the experts in reading x-rays.
Right.
They also included doctors from other specialties that might not look at x-rays every single day.
Yeah, like a cardiologist might order a chest x-ray, but
That's
not
right.
be like the expert at reading it, right?
Exactly.
So that's super interesting. They included those different levels of expertise.
So there was 69 doctors in total.
Okay.
And they had to each review 12 different chest x-rays.
12 x-rays.
Yep.
Were they all pretty simple, or were they kind of all over the place in terms
They
of...
included things like masses, fluid around the lungs, even collapsed lungs.
Wow.
So these are all pretty
Serious stuff.
serious, yeah. You want to make sure you get the diagnosis right. And to make things even more interesting, they actually purposely set the AI's accuracy to only about 67%.
Wait, why would they make the AI less accurate?
So that's the whole point. They wanted to see how the doctors would react when the AI got things wrong.
Oh, that's interesting.
Would they just blindly trust the AI, or would they rely on their own training and experience to be like,
Right.
no, this is not right?
Something's off.
Exactly.
Oh, that's fascinating.
So to do this, they presented the AI results in 4 different ways.
Okay, what were the 4 ways?
So the first one was just the AI's diagnosis, like nothing else. Just here's what I think it is.
Okay.
The second one, they added what's called a saliency map. So it basically highlights the important parts of the image. So it draws your attention to certain areas.
Okay.
The third group got that 2FR that we talked about with those similar x-rays.
Got it.
And then the last group, the control group, got no AI help at all.
Okay.
They just got the x-ray.
Okay, they really had like a full spectrum of like
Exactly.
nothing.
Yeah, like the whole range.
Yeah, a bunch of help.
Yeah.
And I imagine this was to see, okay, what is the best balance of AI and human judgment? So what happened? What were the results?
So the results were actually really, really interesting, especially when it comes to this 2FR thing.
Okay.
And how it impacted their accuracy and confidence.
Okay.
So when the AI got the diagnosis right, adding those extra explanations, especially that 2FR, really helped the doctors.
Interesting.
They were more accurate overall.
Yeah.
And the radiologists, the experts, actually saw the biggest benefit from it.
Okay.
It's almost like it sped up their process on those easier cases.
Right. So like if you're already an expert and you see what you think is the right answer and the AI agrees with you, it's like,
Exactly.
great, yeah, I was right. Let's move on.
Yeah, just a quick validation.
But what about when the AI got it wrong? Did those explanations trip them up?
That's where it gets really interesting.
Yeah.
When the AI got the diagnosis wrong.
Yeah.
It didn't actually matter how the results were shown.
Oh, interesting.
The doctors, regardless of their specialty, they just relied on their own skills and knowledge.
So it's almost like the human expertise kicked in.
Exactly.
And said, hold on, something's not right here.
Yeah, exactly.
That's reassuring.
It is. It shows they're not just blindly following the AI.
Right.
But here's the thing. The study also found that the doctor's confidence levels
Okay.
stayed pretty much the same,
Oh.
regardless of whether the AI was right or wrong.
Wow. So even when the AI messed up, they were still like,
Yeah, pretty much.
pretty sure this is it.
Yeah. And that's a little concerning.
Yeah, that is a little concerning because you want them to be more cautious when
You would think.
the AI is wrong, right?
Exactly.
So is that like a potential red flag?
Well,
Too much reliance
It could be.
on the AI even when it's
Exactly.
not doing well?
Especially if they're not really evaluating what the AI is saying
Right.
and just taking it at face value.
So almost like we need to give doctors like a healthy dose of skepticism
Skepticism, yeah.
when it comes to these AI tools.
Absolutely.
Interesting.
But there was a positive finding as well.
Okay, tell me about the positive finding.
So the study also found that 2FR was really, really helpful when doctors were already feeling unsure about a diagnosis.
Oh, so when they were on the fence already,
Exactly.
those extra images helped them be like, okay,
Yeah, it gave them more confidence.
now I feel better about this decision.
Exactly.
Wow, so in
Yeah.
those tricky situations, it really made a big difference.
Huge difference.
That's fascinating.
Yeah, it's like having that extra safety net to double check and validate your thinking.
Now, all this research was focused on chest x-rays, but do you think this 2FR approach could work for other types of medical imaging?
I think it could.
Like what about
Like what if you're,
CT scans or MRIs?
yeah, CT scans, MRIs, even those microscopic images they use in pathology?
Could those doctors benefit from having similar images to compare?
I think so, yeah, because,
Yeah.
I mean, the underlying principle is still there. Like doctors are trained to look for patterns and compare cases.
Right, no matter what they're looking at. So
Yeah.
giving them a tool that helps them do that better seems
Makes sense.
like it would be a good thing.
Imagine you're a cardiologist. You're looking at a heart scan.
Okay.
and you see something weird, something you haven't seen before, it would be amazing if the AI could just pull up a bunch of similar scans from patients who had like a confirmed diagnosis.
Right. So you could
compare side by side.
compare and say, oh, okay,
This is what this looks like.
right.
Yeah.
That's incredible.
So it's like having a whole team of experts at your fingertips.
And it wouldn't have to be limited to images, right? Like, what if the AI could also pull up
Oh, yeah.
relevant research articles?
Yeah, research articles, case studies, maybe even connect you with a specialist for a second opinion.
This is really exciting stuff. Like, it feels like we're on the verge of something truly transformative in healthcare.
I think so.
But like with any really powerful tool,
Yeah.
there's the question of responsibility.
Absolutely.
So how do we make sure this is used ethically and effectively and that it benefits both doctors and patients?
That's the big question. We can't just throw AI into the mix and hope for the best.
Right.
We have to be really careful about how we integrate it into how doctors actually work, how they're trained to use it, and even how we address potential biases that might be in the technology itself.
You hit on a really important point there, bias, because we've seen in other fields how AI can sometimes perpetuate bias without us even realizing it.
Right.
So how can we make sure that doesn't happen in healthcare where the stakes are so high?
I think transparency is really key here.
Okay.
Like, we need to understand how these AI systems are built, what data they're using to learn, and what factors could be influencing their decisions. And it's not just about the technology itself. It's about the people who are designing it, building it, using it.
Yeah.
We need to make sure that we have a diverse group of people involved in the whole process.
It sounds like a really multifaceted challenge that requires a lot of different people.
Absolutely. It's going to take technologists, clinicians, ethicists, even patients to really get this right.
This all makes me think about the role of education, both for doctors and for the public.
Yes.
Doctors need to be trained not just on how to use the AI, but also how to question it.
Yes. How to think critically about it.
Think critically.
Yeah.
And patients need to understand what AI can and can't do.
Exactly.
So they can have informed conversations with their doctor.
Absolutely.
We've talked a lot about chest x-rays today, but it's clear this conversation has implications.
Oh, yeah.
Way beyond radiology. Like, AI is being used in all sorts of different medical specialties now.
Everywhere.
So what are some of the other really exciting applications you're seeing?
Oh, there's so many. I mean, imagine AI that can help protect which patients are most likely to get a certain disease.
Wow.
So you can intervene earlier and maybe have better outcomes.
Right. So it's almost like a customized medical grade map for each person.
Yeah. Personalized medicine.
This is incredible.
AI has the potential to totally revolutionize how we prevent, diagnose, and treat disease.
It really does.
But we have to make sure that we're doing it ethically and with the patient's well-being in mind.
Absolutely. So as we kind of wrap up this first part of our deep dive, I want to ask you, our listener, a question. Does all of this make you feel more or less optimistic about the future of medicine? And what role do you think AI should play in your own healthcare?
That's a good question.
It's definitely something to think about.
It is.
AI is not a cure-all,
No.
but it is a powerful tool.
Powerful tool.
That could really change healthcare for the better.
For the better, yeah.
So as we move forward,
it's
really important that we have these open and honest conversations about how to use it responsibly.
Absolutely.
And make sure that it benefits all of us.
It has to.
All right, so we're going to take a quick break, but when we come back, we'll delve even deeper into the potential and the pitfalls of AI in healthcare.
Sounds good.
So we left off talking about 2FR and how it impacted accuracy and confidence.
Right.
I'm really curious to dig into that.
Yeah.
Like, how much of a difference did it actually make?
Well, like I was saying, when the AI got the diagnosis right, those extra explanations, especially the 2FR, really, really helped.
The doctors were more accurate.
Much more accurate overall.
Wow.
And actually, the radiologists, the experts, they got the biggest benefit.
Interesting.
Yeah, it was almost like it sped up their process on the easier cases.
Yeah, I can see that.
Like if you're already an expert, you see what you think is the right answer, and the AI agrees with you.
Right.
Those extra images are just kind of like a quick validation.
Like, okay, cool, I know what I'm doing, let's move on.
Exactly.
But what about when the AI got it wrong?
That's where it gets really interesting. When the AI messed up, it didn't actually matter how the results were shown.
Really?
Yeah, the doctors, no matter what their specialty was.
So both the radiologists and the other doctors.
They relied on their own knowledge and skills.
So it's like their training and experience kind of took over.
Exactly.
That's kind of reassuring in a way, right? Like it shows they're not just blindly trusting the machine.
Right.
But I'm guessing there's a but here.
There is a but.
Okay, give me the but.
The study also found that the doctor's confidence levels
here we go.
stayed pretty much the same.
Regardless of whether the AI
regardless,
right.
It didn't matter
wow.
if the AI was right, if it was wrong.
So even when the AI was messing up, they were still
pretty confident.
Feeling good.
Yeah.
That seems a little concerning.
It is. It's a little concerning.
Because ideally, you'd want them to be a little more cautious.
A little more hesitant.
When they know the AI's track record isn't perfect.
Exactly.
So is that like a sign of potential over-reliance?
Yeah.
On the AI?
Especially if they're not really taking the time to evaluate what the AI is saying.
Right, right.
and just kind of blindly trusting it.
Like we were talking about earlier.
Exactly.
Almost like we need to teach doctors to be a little bit more skeptical.
A healthy dose of skepticism?
Yeah.
I think so.
When it comes to these tools.
Absolutely.
But you said there was a positive finding with 2FR.
Yes, there was.
When doctors were already feeling unsure.
Exactly.
So tell me about that.
So the study found that 2FR was incredibly helpful when doctors were already on the fence about a diagnosis.
Okay, so they're looking at the x-ray and they're like, I don't know.
Yeah, they're not sure.
And then 2FR comes in and helps them.
Yeah, those extra images.
So similar images.
Yeah, they give them that extra bit of confidence.
To make a call.
To say, okay, I think this is what it is.
Wow. That's powerful.
It is. It's really powerful, especially in those tricky situations where a misdiagnosis could be really bad.
Absolutely.
So it's like having a safety net.
Like a backup.
Exactly.
To just double check and validate your thinking.
Makes you feel better about your decision.
So we've talked about 2FR with chest x-rays.
Right.
But do you think this idea could work for other types of medical imaging?
I think it could.
What about like CT scans?
I mean, why not?
MRIs?
Why not?
Yeah. Those microscopic images pathologists use.
Like it could be anything, really.
Yeah. Could those doctors benefit from having something similar to 2FR?
I think so because, I mean, the underlying principle is the same.
What do you mean?
Well, doctors, no matter what their specialty is, they're trained to look for patterns and compare cases.
Yeah, that makes sense.
So if we can give them a tool that helps them do that more effectively,
right.
Why not?
So it's not about the specific image.
Exactly.
It's about the process.
The thought process.
Comparison.
Yeah.
Okay, I like that.
Imagine you're a cardiologist.
Okay.
You're looking at a heart scan, and you see something that's just weird, something you've never seen before. Wouldn't it be amazing if the AI could just instantly pull up a bunch of similar scans?
From other patients?
Yeah, from patients who have like a confirmed diagnosis.
So you could compare and say, okay, this is what
this looks.
This actually is.
Yeah.
That's amazing.
It would be like having this whole team of expert consultants right there.
Right at your fingertips.
Right there.
And it wouldn't even have to be just images.
No, it could be research articles.
What if it could pull up
case studies,
relevant research articles, case studies?
Maybe even connect you with a specialist for a second opinion.
This is blowing my mind a little bit.
I know, it's pretty cool.
It feels like we're really on the edge of something huge here.
Yeah, transformative.
In healthcare.
Absolutely.
But of course, like with any really powerful tool, there's that question of responsibility.
Always.
Right? Like how do we make sure that this is used ethically, effectively, that it actually benefits both doctors and patients?
That's the big question.
Yeah, so how do we do that?
Well, we can't just throw AI into the mix and hope for the best.
Okay.
We have to be really thoughtful about how we integrate it into clinical workflows.
So how doctors actually work day to day.
Exactly.
Right.
We have to think about how doctors are trained to use it.
Okay.
And how we address any potential biases in the technology itself.
That's a big one, bias.
It is a big one.
Because we've seen in other areas how AI can perpetuate biases.
Exactly.
Even without us realizing it.
Right. It can happen very subtly.
So how do we make sure that doesn't happen in healthcare where the stakes are so high?
I think transparency is really key.
Okay, what does that look like?
Well, we need to understand how these AI systems are built, what data they're trained on, and what factors might be influencing their decisions.
So it's not just about the technology.
It's not just about the tech.
It's about the people behind it.
It's about the people who are designing it, building it, using it.
Right.
We need to make sure that we have a diverse group of people.
At the table.
Yeah, at every stage.
Involved in the whole process.
Absolutely.
So it's a multifaceted.
It's a huge challenge.
That requires a lot of different perspectives.
It does.
And this makes me think about education.
Yes.
Both for doctors and the public.
Oh.
Doctors need to be trained not just on how to use AI,
right,
but on how to question it, how to think critically about it.
To be skeptical.
Yeah, skeptical.
Absolutely.
And patients need to understand what AI can and can't do.
So they can have informed conversations with their doctor.
Yeah. Right, because if you go in thinking that the AI is like a magic bullet,
exactly,
that could be dangerous.
Absolutely.
We've talked a lot about chest x-rays today.
We have.
But it's clear that this conversation has implications way beyond just radiology.
Way beyond. AI is everywhere.
AI is being used in all sorts of different medical specialties.
Yeah, every specialty you could think of.
So what are some of the other really exciting applications that you're seeing out there?
Oh, there's so many.
I mean, it's such a rapidly evolving field.
It's mind-blowing.
Yeah.
Like, imagine AI that can predict which patients are most likely to get a certain disease.
Okay, so we could intervene earlier?
Intervene earlier and maybe prevent it altogether.
Or if not prevent it, at least catch it.
Catch it early.
When it's more treatable.
Exactly, when the outcomes are better.
What else?
AI that can personalize treatment plans.
So not just a one-size-fits-all approach?
No, tailored to each individual patient.
Based on their unique...
Based on their genes, their lifestyle, their medical history.
That's incredible.
It's like having a customized medical roadmap.
That's a great way to put it.
For each person.
Yeah.
AI has the potential to completely change how we approach healthcare.
Really revolutionize it.
But we have to make sure we're doing it ethically and responsibly.
With the patient's best interest at heart.
Always.
All right, so as we kind of wrap up this part of our deep dive, I want to turn to you, our listener, and ask you a question.
Right.
Does all this talk about AI in healthcare make you feel more or less optimistic about the future of medicine?
That is the question.
And what role do you think AI should play in your own healthcare journey?
It's something we all need to think about.
Because AI is a powerful tool.
It is a powerful tool.
And it's not a magic solution.
No, it's not a cure-all.
It's up to us to figure out how to use it wisely.
Wisely and ethically.
And make sure it benefits everyone.
Absolutely.
So we're talking about making sure AI is used ethically.
Right, responsibly.
Effectively in healthcare.
It's a big challenge.
And you mentioned bias.
Yeah.
Being a really important consideration.
It is.
We've seen how AI can perpetuate biases in other fields.
Right, even without us realizing it.
So how do we guard against that in healthcare where the stakes are even higher?
Well, I think transparency is really important.
Okay, what do you mean by transparency in this context?
I mean, we need to understand how these AI systems are developed.
Okay.
What data they're trained on. What factors might be influencing their decisions.
So it's not just about the technology itself.
No, it's about the people behind it.
Right, the humans.
Yeah, the people who are designing it, building it, using it.
We need to make sure that there's diversity in those groups.
Absolutely. A diversity of perspectives.
So this sounds like a challenge that requires collaboration from all sides.
It's going to take technologists, clinicians, ethicists.
Even patients.
Even patients, yeah.
Everyone needs to be involved.
Everyone has a role to play.
And this also makes me think about education, not just for doctors, but for the public as well.
Absolutely. Education is key.
Doctors need to be trained on how to use AI, but also how to critically evaluate it.
Right, not just blindly trust it.
Question it.
Yeah, be skeptical.
And patients need to understand the limitations of AI.
What it can do, what it can't do.
So they can have those informed conversations with their doctors.
Exactly. It's all about empowering both doctors and patients.
So we've talked a lot about chest x-rays today.
We have.
But this conversation is so much bigger than just radiology.
It is. AI is impacting every area of healthcare.
Every specialty.
Yeah, pretty much.
So what are some of the other exciting applications that you're seeing?
Oh man, there's so many.
This field is moving so quickly.
It's incredible.
Yeah.
Like imagine AI that can help predict which patients are most likely to develop certain diseases.
Okay, so we could intervene earlier.
Yeah, potentially prevent those diseases altogether.
Wow.
Or at least catch them early when they're more treatable.
What else?
AI that can personalize treatment plans.
So not just a one-size-fits-all approach.
No, tailored to each individual patient.
Based on their genes, their lifestyle, all those factors.
Yeah, it's like having a customized medical roadmap for each person.
That's a great way to put it.
AI has the potential to revolutionize how we prevent, diagnose, and treat disease.
It's pretty mind-blowing.
It is, but we have to make sure we're doing it ethically and responsibly.
Yeah, with the patient's well-being always at the forefront.
Absolutely. That has to be our guiding principle.
So as we wrap up this deep dive into AI and healthcare,
right,
I want to leave you, our listener, with a final thought.
Okay.
AI is a powerful tool.
Powerful, but it's just a tool.
Right, it's not a magic solution.
It's up to us to use it wisely.
To ensure it benefits everyone.
And to shape the future of healthcare in a way that puts patients first.
It's been a fascinating conversation.
I agree.
Thanks for joining us on this deep dive.
My pleasure.